Hello and welcome to The Explainer. Today we're jumping into a topic that is universal, incredibly complex, and, deeply personal: pain. We're going to break down how it works, how we measure it, and how modern medicine is really evolving to get a better handle on it. So let's start with something we've all experienced.
Yeah, pretty much everyone knows what pain feels like, right? A headache, you stub your toe. It's just part of being human. It's basically our body's built-in alarm system shouting, hey, something's wrong over here. But what happens when that alarm bell just refuses to shut off? When it keeps ringing and ringing long after the original problem is gone? Well, that's when pain starts to morph into something else entirely. And this right here is the crucial idea. Chronic pain isn't just a symptom that hangs on for too long, it's now considered a disease in its own right. The nervous system itself can actually change, and the pain becomes the main problem, completely upending a person's quality of life, their job, and their mental health. So to really understand how to manage pain, we first have to decode what it actually is. And as it turns out, it's a bit more complex than you might think.
Okay, this distinction is absolutely fundamental. Nociception, that's just the raw data. It's the electrical signal zipping up your nerves that says, hey, tissue damage down here. But pain is what your brain does with that signal. It's a totally personal, subjective experience that mixes that raw data with your emotions, your memories, even the context of the situation. It's why two people can have the exact same injury, but feel wildly different levels of pain.
And that's exactly why getting pain management right from the get-go is so critical, especially after something like surgery. If that initial acute pain isn't handled well, it can literally start to rewire the nervous system, which makes it much more likely that the pain will become a chronic, self-sustaining disease. The stakes are just incredibly high. So, if pain is so personal and subjective, how on earth do doctors measure it? I mean, how do you take a feeling and turn it into objective data that you can actually use for treatment? Well, it started with a major shift in how medicine thinks about this. Pain is now systematically checked right alongside your blood pressure, your temperature, your heart rate, and your breathing. It's no longer just some side note or something a patient complains about. It's a core piece of data that has to be tracked and managed. So how do they do it? Well, it often starts with that scale we're all familiar with, right? The rate your pain from 1 to 10 scale. That's a unidimensional tool. But for more complex, chronic pain, the assessment goes way deeper. They use multidimensional scales that look at the whole picture. What does the pain feel like? Is it burning, stabbing, aching? And how does it make you feel emotionally? Is it scary? Is it exhausting? And crucially, they look at pain when you're resting versus pain when you're trying to move. And that last part is huge because get this, pain during movement can be over 200% more intense. No wonder it's such a massive barrier to recovery. Okay, so we've defined what pain is, we've figured out how to assess it. Now, how do we treat it with medication? Well, for decades, the go-to guide has been a really simple but really elegant framework. This is it, the World Health Organization's analgesic ladder. It was first designed for cancer pain, but now it's used all over the place. The whole concept is just beautifully simple. You match the strength of the medicine to the intensity of the pain, one step at a time. Here's how it works. On step 1, for mild pain, you start with non-opioids, things like paracetamol or anti-inflammatories. Now, if that pain sticks around or gets worse, you climb to step 2. Here, you add a weak opioid, like codeine or tramadol. And then for severe pain, you go all the way to step 3, which brings in strong opioids like morphine or fentanyl. And you'll notice that at steps 2 and 3, you usually keep taking those step 1 drugs too. And here's a really clever part of the whole strategy. At every single step of that ladder, doctors can add in what are called adjuvant medications. Now, these aren't your typical painkillers. They're actually drugs like antidepressants or anticonvulsants that work wonders for specific types of pain, like nerve pain. They can really boost the effects of the main drugs, which means you get better pain control, often with lower doses. But here's the thing. That ladder, it's just the beginning. Modern pain management has gone way, way beyond that single framework. Today, it's about using every single tool you've got. You see, the old way of thinking was what we call monotherapy, basically just throwing one type of drug at the problem. But that often meant you needed higher doses, which led to more side effects. The modern approach is called multimodal analgesia. Think of it as a team effort. You combine small amounts of different treatments that work in different ways. The result? A much better effect with fewer side effects. It's about working smarter, not just harder. And just look at the size of this toolkit. It goes so far beyond just pills. We're talking about non-drug strategies like physical therapy and psychological support. We've got advanced tech like patient-controlled analgesia,
those PCA pumps that let patients safely give themselves relief. And then there are these super targeted procedures, like nerve blocks or radiofrequency treatments, that can quiet pain signals right at the source. The whole idea is to build a personalized, comprehensive game plan.
So why is this huge, sophisticated toolkit so absolutely vital? Because of this number, 50%. Up to half of all surgical patients can end up developing chronic pain after their operation. This isn't some rare complication. It's a massive public health challenge that demands the most advanced, most thoughtful approaches we can possibly come up with. So let's bring this all together. With all these scales, ladders, and toolkits, what's the real end goal? What are we actually trying to accomplish here? And this is so important to remember. The end game isn't to get a pain score of 0. The real measure of success is function. It's about getting a person back to work, being able to play with their kids, sleeping through the night, just living their life again. Ultimately, pain management is about life restoration. So let's just do a quick recap. We've seen that pain is this incredibly complex, personal experience, not just a simple alarm. We've learned that good management starts with a systematic assessment, and that while the WHO ladder gives us a great foundation, modern care is all about being multimodal, using a whole diverse toolkit to create a treatment plan that's tailored to every single individual. And that leaves us with one final, and I think really important question. We've established that pain can literally become a disease. So if we know that, how do we shift our entire healthcare system to start treating it proactively, to stop it from becoming a chronic disease in the first place, instead of just reacting after the problem is already entrenched? Something to think about. Thanks for joining us on The Explainer.